Hi everyone, welcome back. Today we're talking about something many people are curious about: what happens after high-definition ab etching surgery. A lot of patients focus on the results, but recovery is just as important. So today I'm here with Dr. Moein to explain exactly what patients should do after the procedure. Doctor, thank you for joining us. Doctor, let's start with the first stage. What happens immediately after the surgery?
Immediately after high-definition ab etching surgery, patients are taken to the recovery area where our medical team carefully monitors their vital signs while the anesthesia wears off. At this stage, it's completely normal for patients to feel some mild soreness, tightness, or swelling in the abdominal area. Because the procedure involves advanced liposculpting techniques to define the abdominal muscles, the body needs some time to adjust and begin the healing process. Patients are usually fitted with a compression garment right away, which plays a very important role in reducing swelling and helping the skin conform to the newly sculpted contours. Before leaving the surgical center, we also provide patients with detailed post-operative instructions, medications for pain management, and guidelines on how to care for their incisions. Most patients can go home the same day, but they must have someone accompany them and help during the first 24 hours.
A lot of patients talk about compression garments. Why are they so important after this procedure?
Compression garments are one of the most important elements of the recovery process after high-definition ab etching. These specially designed garments apply consistent pressure to the treated areas, which helps reduce swelling, improve circulation, and support the skin as it adapts to the new abdominal contours created during surgery. Without proper compression, fluid accumulation and prolonged swelling can occur, which may delay healing and affect the final results. Typically, patients are advised to wear their compression garment almost 24 hours a day for the first few weeks, removing it only for showering. Over time, as swelling decreases and healing progresses, we gradually reduce the amount of time the garment needs to be worn. Consistent use of compression garments significantly contributes to achieving the sharp, defined abdominal appearance that patients are seeking from this procedure.
Another common concern people have is pain. How much discomfort should patients expect during recovery?
Most patients are pleasantly surprised that the discomfort after high-definition ab etching is quite manageable. While the abdomen may feel sore, tight, or slightly bruised during the first few days, the pain is usually mild to moderate and can be effectively controlled with prescribed medications. Because this procedure focuses on sculpting fat around the abdominal muscles rather than cutting muscle tissue, the recovery tends to be smoother compared to more invasive surgeries. Patients may also notice temporary swelling and some firmness in the treated areas, which is a natural part of the healing process. Within the first week, most individuals start feeling significantly better and can move around more comfortably. Following the post-operative instructions closely, including wearing compression garments and staying gently active, helps minimize discomfort and speeds up recovery.
Doctor, many people wonder if they need to stay in bed after surgery. When can patients start moving?
Interestingly, gentle movement is actually encouraged very soon after surgery. Patients are usually advised to start light walking within the first 24 hours, as this helps improve circulation and reduces the risk of complications such as blood clots. Of course, this doesn't mean intense activity. It simply means short, slow walks around the house to keep the body active. Movement also helps reduce stiffness and promotes faster healing. However, strenuous activities such as heavy lifting, intense workouts, or abdominal exercises must be avoided during the early recovery phase. Over time, as the body heals and swelling subsides, patients can gradually return to their regular routines based on their surgeon's recommendations.
Swelling and bruising can worry patients. How long do these typically last?
swelling and bruising are completely normal after any liposculpting procedure, including high-definition ab etching. In the first few days, patients may notice visible swelling around the abdomen and sometimes mild bruising in the treated areas. This is simply the body's natural response to the procedure and the healing process. Most bruising begins to fade within 1 to 2 weeks, while swelling gradually decreases over several weeks. However, subtle swelling can persist for a few months before the final results fully appear. Wearing compression garments, staying hydrated, and following post-operative care instructions can greatly help reduce swelling more quickly. It's important for patients to understand that the body needs time to heal, and the most defined results typically become more visible as the swelling continues to resolve.
Doctor, many patients also want to know how soon they can return to work.
The timeline for returning to work depends largely on the nature of the patient's job. For individuals with desk jobs or relatively light daily activities, many are able to return to work within 3 to 5 days after surgery. During this time, they should still avoid heavy physical exertion and follow the post-operative guidelines carefully. However, for patients whose work involves physical labor, lifting, or intense movement, a longer recovery period may be necessary. In those cases, we may recommend waiting 2 to 3 weeks before resuming full duties. The key is allowing the body enough time to heal properly so that the surgical results remain intact and complications are minimized.
And what about exercise? Everyone wants to get back to the gym.
Exercise is important for maintaining results, but timing is crucial. In the early stages of recovery, patients should focus on light walking only to maintain circulation and support healing. More structured workouts, such as cardio or strength training, are usually reintroduced gradually after about 3 to 4 weeks, depending on how the patient is healing. Abdominal exercises in particular should be approached with caution since the area needs time to fully recover from the sculpting process. By around 6 weeks, many patients are able to return to their normal workout routines, provided they receive clearance from their surgeon. Starting too early can increase swelling or interfere with healing, so patience is extremely important during this phase.
This is the question everyone is waiting for. When do patients actually start seeing their results?
Some improvement can be seen fairly early, even within the first couple of weeks, once the initial swelling begins to subside. However, high-definition ab etching results evolve gradually as the body continues healing and the skin tightens around the sculpted abdominal muscles. Most patients notice a significant improvement in their abdominal definition within 6 to 8 weeks, but the final refined results typically become visible around 3 to 6 months after the procedure. This gradual transformation is completely normal and reflects the body's natural healing process. Maintaining a healthy lifestyle, staying active, and following post-operative instructions will help preserve and enhance those results over time.
Doctor, before we wrap up, what is your most important advice for patients recovering from high-definition ab etching?
My most important advice is for patients to treat the recovery process as an essential part of the procedure itself. Surgery creates the foundation for the sculpted abdominal appearance, but proper aftercare ensures that those results heal beautifully and last long term. Patients should follow their surgeon's instructions carefully, wear their compression garments consistently, stay lightly active, and attend all follow-up appointments so that progress can be monitored. It's also important to maintain a healthy lifestyle through balanced nutrition and regular exercise once healing is complete. When patients approach recovery with patience and discipline, they can achieve the sharp, natural-looking abdominal definition that high-definition ab etching is designed to deliver.
Thank you so much, Dr. Moein. That was incredibly helpful and answered many questions patients usually have. And if you're considering high-definition ab etching or want to learn more about the recovery process, make sure to consult with a qualified specialist.